When you have a bill that you're unable to afford that's owed to a medical institution, sometimes if you wait too long to pay for it or to deal with it directly, it may end up on your credit report. But before it ends up on your credit report, it's most likely going to go to collection. Now, there's different kinds and different ways that a bill could be in collection. If it's a relatively recent bill within the past number of months or even within the past year, you may not know this, but as a matter of fact, in many cases, you can go, instead of dealing directly with that collection agency, you can go directly to the original medical provider where you incurred that bill, where you sought the original service, and talk to them about pulling it back from collection, pulling that bill back from collection. I think it is always better to deal directly with the medical provider than to deal with the collection agency. The job of the collection agency is to collect on that bill. The job of the medical provider is to provide those medical services, but they often do then have this collection, this need to then collect the bills that they charge people. But that said, especially nonprofit hospitals and other nonprofit medical providers really do want to work with people. They often look at themselves as charitable institutions on a certain level. I always think it's better to work directly with that medical provider, even if the bill is in collection. When you talk to the manager of patient accounts, ask the manager to pull that bill back from collection and work with you directly. If they say they can't do that or they can't work with you, ask to speak to their supervisor. Ask to speak to somebody else within that organization who has more power to make a decision over this. Oftentimes that person is the chief financial officer. Particularly if it's a hospital, the chief financial officer is going to often have the final decision-making ability over that kind of issue. It is definitely better to work directly with the provider than with the collection agency. Now, just because your bill is in collection doesn't mean it's on your credit report. But if it is in collection, there's a higher chance that it has ruined your credit. I suggest that you check your credit report to see if you have any medical bills on there, if you think that that could be a possibility. How do you check your credit report? Well, there's a few ways to do it. If you have access to the internet, a very good way is to go to www.annualcreditreport.com. I'm going to say that again, www.annualcreditreport.com, ANNUAL creditreport.com. That is the official place, the official site set up between the government and the three major credit bureaus, Equifax, Experian, and TransUnion, that the government and these institutions have set up so that people can access a free credit report online. Now, as a Massachusetts resident, you can also ask for an additional free credit report through the mail. And if you don't have access to the internet, you can, of course, also ask through the mail for a credit report. Now, when you look at your credit report, what you want to be looking for is the original creditor under the collections field of the credit report. If a medical debt is on a credit report, in the vast majority of cases, it's been reported by a collection agency. In general, medical providers do not report bills to credit reports directly, to credit bureaus directly. It's not your doctor's office or your hospital that's going to report your bill. It's the collection agency that they work with, that they have employed. Now, you're going to look for the name of the collection agency, and if you get your credit report from annualcreditreport.com, then you can look under the original creditor field and see who that original creditor was. And if it was a hospital, a doctor's office, or an ambulance company, it should say very clearly who that is. And then you know exactly where you owe that bill. Still, when you find out who that original creditor is, go directly to the original creditor. Go to that hospital, call their billing office, talk to the manager of patient accounts or to somebody else in the hospital hierarchy, and talk to them about negotiating your bills, getting charity care and financial aid, but also you want to talk to them about public programs and the fact that there could be public programs that should have covered your bill. And if you have private health insurance, we of course want to make sure that your private health insurance paid what it should. Now I'd like to talk a little bit more about private health insurance. Individuals who have cost sharing under their private health insurance, deductibles, co-payments, or co-insurance, those individuals who have those kinds of cost sharing, they still may owe this money out of pocket, but the insurance probably paid what it should have if they don't have a denied service. Now, if you have a denied service under your insurance, you have every right to make an appeal. Many people don't realize that they can make appeals to their insurance company when it didn't pay what it should have paid. Now that doesn't mean that if you have a deductible and it's outlined in your policy, well, that's your deductible, just as the policy said it is. There's not much you can do in terms of making your insurance pay more of that. You can, of course, negotiate it and get charity care, or in some cases even get public programs to help you pay for that deductible. But what I'm trying to make the point is that if you have a denied service, you can look at your explanation of benefits form, your EOB. I'm going to say that again, explanation of benefits form. That's the sheet you get in the mail that says, this is not a bill. It's from the insurance company, and it isn't a bill. But it tells you what your insurance paid, what it didn't pay, what your out-of-pocket cost is, and how much the original service cost, and who the money is owed to. Now, it's very important to look closely at the explanation of benefits forms and compare your EOB's, explanation of benefits, to the original bill that you received. Look at them. Make sure that they are parallel. Make sure that the information is correct in each one. These materials can be very difficult to understand, but I think it's very important to take a look and try to understand them the best that you can. And if you have questions, call your insurance company. Ask for a manager once again. Call your doctor's office. Ask for a manager. It is very important to try to determine if a service was denied. And if it was denied, it will say on the explanation of benefits form not only that it was denied, but why. There's usually a code, and you can look at the translation of the code that will be on the explanation of benefits, usually near the bottom or in the middle of the page. And in those cases, you have the right to make an appeal to the insurance company. You should write a letter of appeal to that insurance company, but there's always a time limit. You want to do your best to appeal as soon as possible. And if that appeal is denied, guess what? You also have the ability to do a second level appeal and often even a third level appeal.